Hi, I'm Dr. Deborah Furtado. I am a doctorate of nursing practice, family nurse practitioner, and owner of Seaside Primary Care. It's a hormone replacement clinic and a weight loss center. We've been doing a lot of good work over the last 4 years here. This is my 5th year. I'm starting in October, which we're really excited about. But basically, when I see my patients, what my patients ask me are the same kind of questions about their health as women and men. This particular series today is just on women, but the truth of the matter is estrogen in women is their life hormone. It's one of the most amazing hormones to the human spirit, okay? It is the thing that creates life, okay? Our ovaries are our sex glands. Those unfortunately stop working because we have a clock. We have a clock. Our clock is to make a baby. Whether we like to hear it or not, we make babies. And we need that estrogen to support the health of our body overall. Like, it's not just about the baby, it's about our bone health. It's about our brain integrity. It's about neurotransmission. It's about the gut biome. It's about muscular strength, vitality, sex appeal, skin, hair growth. Estrogen is the queen, okay? And specifically estradiol, because remember there's 4 types of estrogen, and estrone is a predominant type that happens in postmenopausal because we've got to have some estrogen. Our body will make estrogen out of fat cells of the abdomen. And once it does that, it's an inflammatory kind of estrogen, but it's essential. We need something to live. We need some estrogen to live. Estradiol is the replacement hormone that we need, and it's got to be body identical. It's got to be just right for the human. It's not a birth control pill. That's synthetic, meaning chemicalized, chemically made. There are creams and there are gels and there are oral tablets of estradiol. That is the estrogen that you need as a woman to maintain your life, your health, your life status. The number 1 cause of death in women postmenopausal is actually cardiovascular disease, because estrogen is the sort of moderator of the internal vascular layer, okay? And once that estrogen is depleted, we become more masculinized and catch up to men in cardiovascular disease and actually surpass them in death rates. That's our number 1 cause of death. The number 2 cause of death in women postmenopausal, and this is a shocker, is urinary tract infections that go septic, and it gets into your bloodstream. And why would that be related to estrogen? Because estrogen supports those tissues. It makes the bladder and the tissues associated with it more plump. It keeps the bacterial content normalized. It helps with moisture. Once those tissues start to thin out and you have, an irritable area when you're having relations, when you're trying to, keep a bladder that's healthy, you need estradiol. Estradiol is what you need. And there's different forms that you can take. Some can be placed right in the vaginal canal, which will support the bladder. That is a great option. Orally, you could take an estrogen, and that could do it, but there's a lot of research that indicates using estrogen in the vaginal area is much more effective, especially if you have chronic UTIs. And ladies, it doesn't matter how old you are, you can use it. Even women who suffer from cancers, there's a low-dose vaginal estrogen with DHEA in it that'll moisturize and make that pain go away if you're having burning or thinning of that skin postmenopausal or being on those meds post breast cancer treatments. Yes, you can lose weight, you can look younger, you can apply estrogen cream to your face every night. on your skin, on your face, low doses, just to the areas that bother you if you'd like. You can also use it on your inner arm. You can apply it there. You can put a patch on your hip. There's so many different things you can do, but you really need to know that estrogen is what you need for optimal health, for vitality, for vigor. Okay, this is no joke. We now need to understand estrogen like never before. Okay, thank you.